Tinatawag nilang new normal ang mga aksyong nakasentro sa pagpapahalaga sa kalusugan. Ginagawa natin ang new normal behaviors na ito ngayon upang makaiwas sa COVID-19. Pero kung tutuusin, marami sa mga hakbang na ito ay mga kaugalian na ating natutunan at dapat ginagawa noon pa man. Makakatulong ang mga ito sa pag-iwas sa anumang sakit. Tulad ng paglilinis ng kamay, tinuro sa atin simula pagkabata na maghugas pagdating sa bahay, bago kumain at pagkagamit ng palikuran. Sa panahon ngayon, dapat mas madalas na ang paglilinis ng kamay. Bukod sa paggamit ng tubig at sabon, maaaring gumamit ng alcohol-based hand rub o sanitizer kahit nasan ka man. Kapag naglilinis ng bahay, kailangang mas dalasan ang pag-disinfect ng mga bagay na palaging hinahawakan. Makakagawa ng pang-disinfect gamit ang ordinaryong bleach na panglaba. Maghanda ng isang parte ng bleach at ihalo ito sa 9 na parte ng malinis na tubig. Kung hindi naman emergency, hindi na kailangan pumunta pa sa doktor dahil sa telemedicine. Kapag nahihirapan sa paghinga at iba pang malalang sintomas ng sakit, agad na kumonsulta sa doktor. Maaari ring tumawag sa Barangay Health Response Team o BHERT. Huwag kalimutan ang mga natutunan dahil ito ang ating sandata para maging handa sa new normal.
Magandang umaga po. Good morning to all our viewers. Welcome to day 2 of the Healthy Seniors webinars, a series by the Department of Health and WHO Philippines, together with the Philippine College of Geriatric Medicine and the UP National Institutes of Health Institute of Aging. My name is Dr. Albert Domingo from the World Health Organization Philippines office, and it is my honor to be your moderator for this webinar series. Yesterday, we opened the series with a lively discussion on how to stay safe at home. Ang ganda ho ng talakayan kahapon. We gave particular attention to the promotion of the health of older people or senior citizens, as we lovingly call our lolos and lolas. We even got fitness tips for seniors. Today, I am joined again by our panelist from the WHO Regional Office for the Western Pacific, Dr. Hiromasa Okayasu, or Dr. Hiro. And today's session will be about healthcare pathways for the elderly. We will discuss what to do if an older person has symptoms, what to do for the sick who are homebound, and also what to expect and what to do for our older patients and relatives who fall ill in this time of COVID-19. To help us with these topics, we will hear from our expert speakers and panelists this morning, Dr. Sibel Abad, an infectious disease specialist, Dr. Pearl Cuevas, a nurse specializing in geriatrics, and Mr. Tom Hayet, one of our epidemiologists at the WHO country office. Can I ask Dr. Pearl and Dr. Sibel to please show video if it's okay, ma'ams? There. Yan po. Si Dr. Sibel and si Dr. Pearl. Yan. So, yan po ang ating mga panelists, also with Mr. Tom Hayet. And our format is the same. We will hear from our 3 speakers and then we will have an open forum. To ask a question, we highly encourage those in the Zoom room to please use the Q&A button in your app. You may type in your questions there. For those joining us from YouTube, welcome po. Please type your questions into the live chat box. So we are all set. We have 438 in the Zoom room right now. I'm just checking the numbers. Sa ating YouTube channel, we do have 55. And this is bound to go up. It's just 11:04 in the morning. Medyo magkakaroon tayo ng konting lag. So in a few minutes, expect that there will be more people coming in. All right. So the sequence is Dr. Sibel Abad first, and then Dr. Pearl Cuevas, and then Mr. Tom Hayet. So we're all set. I will now pass over to Dr. Sibel Abad, our infectious disease specialist, to discuss what to do. Anong gagawin natin if an older person has fever and cough? Over to you, Dr. Sibel.
Thank you very much, Dr. Albert. Let me just share my screen over here. Good morning, everyone. Thank you to the WHO and the Department of Health for inviting me to join this webinar series on the elderly. I was asked to talk about the elderly at risk. And so for the next 10 to 15 minutes, we will be going over why the elderly are at risk for severe disease, describe the risk of COVID-19 among the elderly, and finally describe the initial approach to symptoms. So why are the elderly at risk for severe COVID-19? The reasons are several fold. The first reason is the presence of comorbid illnesses. As we grow older, we know that we collect certain diseases of lifestyle, such as diabetes, hypertension, and chronic obstructive pulmonary disease if we're smokers. So these comorbid illnesses increase the risk of COVID-19 regardless of the age. Second, there is a phenomenon called immunosenescence. Simply put, it means that the immune system is also growing old, and so it might not be as robust or as effective as it once was. So it's kind of more slow and more sluggish in terms of response. And finally, there is aberrant ciliary function and ciliary ultrastructural anomalies. So the cilia is the hair that lines the nasal passages and the upper airways. These get to be degraded over time, and so the elderly does not have this much protection. It's the first barrier to trying to filter out viruses and certain bacteria. Trying to look at it in a diagram form, so SARS-CoV-2 is the agent responsible for COVID-19. There can be asymptomatic carriers who carry this virus in the upper airways. And if these carriers visit you in your long-staying residential care homes or long-term acute care facilities or your homes, they can be the potential source of infection. And as mentioned, because the elderly have aberrant ciliary function, so there's delay in ciliary clearance, and there's immunosenescence, meaning the immune system is not as robust and not as vigilant. This virus can then go to the lung, where it causes lung failure in the form of acute respiratory distress syndrome, or ARDS. So when you develop ARDS, you develop lots of inflammation in the lung. It gets filled with water and it has difficulty ventilating air. There's also what you call inflammaging, meaning aging by itself is a pro-inflammatory response. If you add to that a virus or an illness, you then tend to create what you call a cytokine storm. A cytokine storm is simply lots of chemicals increasing the inflammation in your body. Add to that, again, the presence of comorbidities. All these contribute to the increased risk of death. So how do we define the elderly at risk? I know we all want to be young at heart, but by definition, the older age group is often defined as age above 60. And evidence suggests that advanced age is the most important predictor for fatal outcome. In fact, the proportion of deaths over 60 years and above account for more than 80% of the total deaths from SARS-CoV-2. This implicates that this older population are really more vulnerable to this virus, which is why we have this webinar series trying to convince everybody to stay at home. This is a very nice infographic from the US CDC. It really shows you the risk of hospitalization and the risk of death according to age. So the comparator group is the young adult over here. And if you look to the right, older adults are over here, and the risk of hospitalization is 5 times to 13 times higher, and the risk of death is 90 times to 630 times higher in this older age group. If you look at the numbers in the Philippines, for example, so this is as of October 17, we have breached the 350,000 mark nationwide. And if you look at the average age overall, it's really the young working adult who are getting infected with COVID. But the average age of death, if you look at the middle block over here, it's above 60. And the average age of recovery really mirrors the average age of COVID overall. If you look at the mortality by age group and you look at the 20 to 29 interval, you find that of 83,000, only about 153 have died. In contrast, if you look at the 80 to 89 age group, there's only about 3,400 of them, and yet 582 have died. So if you do the math, and if I did the math correctly, you find that the mortality rate between the two age intervals is 0.1 versus 17%. So this goes to show that the high mortality rate in the elderly is really the underlying reason why this vulnerable subpopulation should stay at home. Now, someone mentioned earlier, or yesterday rather, that you can still develop symptoms at home. And why is that? So your visitors can bring the virus to you. Now, your well-meaning family members, your neighbors who don't want you to be depressed or isolated, visit you, and they may be asymptomatic carriers of COVID-19. Same thing with your drivers, your household help, the Grab driver who brings you food or your groceries, so they can bring the virus to you. So you should always self-monitor for signs and symptoms of COVID-19. And what are these signs and symptoms? So these include fever, fatigue or feeling tired, mucus production or phlegm production, sore throat, dry cough, muscle pains or muscle aches, and shortness of breath. There's also what you call dysgeusia, which is loss of sense of taste, and anosmia, which is loss of sense of smell. Now, dysgeusia and anosmia are more common in the younger age group, and studies have shown that fever, production of phlegm, and dry cough are really more common in the older population. So if you develop one or all three of these, then perhaps you should be seen sooner rather than later. Also, if you develop symptoms, you should move to a location away from others. So isolate yourself right away and consider a separate room to serve as your isolation room with a separate bathroom if at all possible. By doing this, you will help slow the spread of COVID-19 within your household. Now, I know that not all households are blessed with extra rooms. So if you don't have that extra room, you can perhaps put up a temporary barrier, such as a curtain or a wooden barrier, just to physically separate yourself from others. Also, restrict interaction with other members of your household. There should be a no visitor policy in place. And as mentioned, consider early consultation via telemedicine or via virtual consult if you can. It's also nice to have a plan for transportation to the hospital before you need it. So you should have a plan A and a plan B and a plan C in place. And I think the final talk for today will be going over the care pathway or the plans you should have in place. Several symptoms may be alarming. So should these symptoms happen, you should probably call a friend or 911 sooner rather than later. So these include dyspnea or difficulty breathing or low oxygenation. So if you have a portable pulse oximeter, it's a nifty tool that you put in your finger and it detects your oxygen. If it's below 94%, then perhaps you should see a doctor. If you have inability to stay awake, hopefully not right now, but if you can't stay awake, then perhaps you should also see a physician, or if you develop chest pain. So all these may or may not be COVID-19. They're kind of alarm symptoms which make you want to call someone right away. Now, I also advocate to be tested for SARS-CoV-2, but do not wait for the test before isolating yourself. So start isolation while waiting for the test. Often we get consults where the people go around in the community because they're still waiting for the test results. And so that puts others at risk. So stay at home, wait for the test result. Often there are labs now doing home-based testing or drive-through testing so that you don't have to put yourself at unnecessary risk. Now, other members of your household are already considered at risk, and they should be quarantined. They must be quarantined for at least 14 days, and unfortunately, they should not be allowed to go out of the house. So if you have a young adult or a teenager living with you, or a working adult, they should no longer be allowed to leave. So there's kind of a domino effect in the household. These close contacts or household members can be tested about 5 to 7 days after last exposure to the COVID-19 positive member, or at any time if they develop symptoms. The gold standard for COVID-19 testing is still the RT-PCR test, but recently the antigen test has been approved for use. Remember, it's the antigen test, not the antibody test. So this is a simplified algorithm. So if you develop symptoms and you have difficulty breathing or low oxygenation below 94%, perhaps you will need some oxygen or admission to the hospital. If you're feeling pretty good, you can potentially get some tests, including baseline laboratory tests or perhaps an X-ray. And if it's consistent with viral pneumonia or SARS-CoV-2, and you feel pretty good with good oxygenation, then perhaps you can stay at home or in a quarantine facility. Remember that not all your symptoms may be viral pneumonia or SARS-CoV-2. Bacterial community-acquired pneumonia may still be out there. So if this occurs, you should still get treatment for community-acquired pneumonia. So to summarize, I hope I've convinced you that the elderly are the most vulnerable group because of multiple factors, including immunosenescence, mucociliary clearance, problems with mucociliary clearance, and the presence of comorbid illnesses. At age above 60, the risk of death is 90 to 630 times more, and the risk of hospitalization is 5 to 13 times more compared to the young adult age group. Symptoms are highly variable, but typically include cough, fever, and sputum production. Early recognition of these symptoms are imperative so that you can be triaged whether or not you should go to the hospital or if you can stay at home. And I think that's my last slide. Thank you very much. And hopefully, mom and dad, you stay at home. And that's it. Thank you very much.
Thank you, Dr. Sibel, for that presentation. If you're all wondering why Dr. Sibel is very emphatic on please stay at home, just information also. Dr. Sibel is an active practitioner. In fact, ma'am, you're the chair, if I remember, of the Infection Prevention and Control Committee at the Medical City. Yes, so Dr. Sibel is an infectious disease specialist, and she was one of those who saw the early stages of the pandemic in the Philippines. She has personal experience in seeing patients, and I understand a lot of those who were really, in medical terms, what we say toxic, yung pong mga mahihirap talaga na buhayin, were old people. That's just the way it is. And we cannot overemphasize the message that the reason why we are all advising seniors to please stay at home, it's because you are at the highest risk compared to the other age groups. But let me not chat on, and I'll pass on maybe to the next presentation because that's something which can be discussed more by our next speaker. Dr. Pearl Cuevas is a nurse. She has a PhD in nursing, and Dr. Cuevas will be discussing with us what to do for the sick who are homebound. So before Dr. Cuevas starts, I also wanted to highlight the fact in the chat box you will see that I posted a link that the WHO Western Pacific Regional Office team on infection prevention and control developed a course on the Open WHO for infection prevention and control in long-term care facilities. Bigyan ko po kayo ng tip. There are a lot of questions asking if we produce certificates for this webinar series. I have to say it, we do not give certificates for this webinar series, but if you want a certificate, that course on Open WHO gives you a certificate. So you may want to click on that link and it will lead to a certificate which is still related to the topic at hand. But now I'll pass over to Dr. Cuevas for her discussion. Over to you, ma'am.
Thank you, Dr. Albert. Let me just share my screen here. Okay, good morning, everyone. I hope we are all healthy and safe. No, I'm here to discuss to you about healthy seniors. And first of all, thank you for this opportunity to share my life and learnings as someone who cared for senior citizens during this period of the COVID-19 pandemic. I'm Pearl, and I'm the one with the glasses and the bunny ears in this picture, having FaceTime with my 78-year-old mother on her tablet. So the objectives of my presentation is to at least have 70% of our listeners to increase understanding of practical pointers on what to do for the sick homebound, for those caring for senior citizens like me to feel confident about the given options for treatment seeking, and report to have taken at least one action to initiate the use of some alternative ways such as mHealth and telemedicine. So let me introduce you to my family. I'm the eldest in a family of two. My brother is the youngest. Both of us are married now and have our own house in Laguna, while both our parents stay in our old home in Las Piñas. My 78-year-old mother is a retired librarian, and my 73-year-old father is a retired lawyer, and they pretty much just take care of each other in our old home. They used to enjoy going out to malls and different places with us during their retirement. But we visit them once a week, mostly during weekends, with their grandchildren just as often as we can. So when COVID-19 struck and we were all placed in quarantine, it took a toll on my parents. Like most senior citizens, they were afraid to leave the house for fear of contracting the disease. But our main concern is that no one was there to help them. Every day we do video call, FaceTime, because we worry about their health and nutrition. Then came a time when my mother showed signs of dementia with biobehavioral symptoms, and my father was so stressed that he also showed signs of failing physical health. As a nurse, this was my red flag and cost me many sleepless nights. I want to be there for them, but what can I do? I was anxious every day, waiting for the quarantine to ease. Thus, when we were permitted to travel, the first thing I did was to go to my parents' house. So, what to do for the sick homebound? No, first, keep calm. No, it really won't help if we panic together. When we get anxious, I realize that our parents get anxious 3 times more than us. Thus, it won't help with their condition. So initially, I made my assessment to determine the severity of their condition. My father has increase in blood pressure and blood sugar related to stress, and my mother showed signs of apathy and poor decision making. To me, both are of equal importance. Let me tell you why. Treating my mother at early onset may still be reversible and would put less stress on my father. This came at a time when all medical and diagnostic clinics are closed, and we also could not set an appointment at any doctor's offices. It's because most hospitals are swamped with patients in COVID-19 tents. Thus, determining the severity of the condition is really more about weighing the risks and benefits of getting the consult. Sabi nga ni Dr. Seibel, stay at home. If it's a simple case of cough and cold that can possibly be treated by over-the-counter medications at home, then it is considered safer to stay at home than go to the hospital where the senior citizen can be more at risk of getting the infection. However, in my parents' case, there's a need to do laboratory and diagnostic tests before a consult can be made and medicines can be prescribed. So the next thing that we do is to look at our choices, no, know our options. What is help out there? I know that doctors are either on the field or stay at home as well. And since time is of the essence for my parents to see a physician, I asked a friend to give me a prescription of the diagnostic test that my parents need to have. We were also able to get hold of a mobile diagnostic clinic with medical technologists on call, who went to my parents' house to get their laboratory test done. The results were emailed to us and we printed it so we can have hard copy once we are allowed to make a consultation. My mother, for my mother, I sought the help of a friend who referred me to a medical doctor who looked into a clinical abstract that I made with the case of my mother. She agreed to prescribe startup medications for my mother pending an actual physical consult. This printed prescription was honored in a drive-through pharmacy where I bought it. Incidentally, the pharmacy also takes in telephone orders, prepares them, and readies the medication for drive-through pickup. It was really quite convenient that there's no need to get out of our vehicle to purchase the medicines. Aside from medicines, it's always wise to ask what else that senior citizens needs. Remember that in evidence-based practice, patient preference is also important. Sometimes, as carers, we get too caught up in what should be done and what we think is best for them that we forget to ask what it is that they really need. It turns out that now my parents need someone to cook for them, make sure they eat nutritious meals, and even manage their finances for them. They also need someone with the skills in technology as they don't know how to email, do video meetings, call for food delivery, and even socialize in social media. Simply put, they want to be cared for. They want us to be there for them. So here's a picture of a text message from the medical clinic where we called to make a diagnostic and consultation appointment. We were reminded through text of our approved appointment date. Of course, there's a picture of my mom and me, so calm while waiting, which is the best alternative at the moment. So again, if the condition is not severe, the best alternative at the moment is to wait for the clinic to open and be available for an appointment instead of placing the senior citizen at risk by going to the hospital. This is the time when you would like to enjoy the help of others. Gather the support of people so that you do not carry the burden on your own. In our case, my eldest niece volunteered to stay in my parents' house to look after them. She does the BP, blood sugar monitoring, food medication, and even their financial management. My brother and I needed to work as the cost of healthcare is quite an expensive out of pocket. We've always reminded ourselves that this is the reason why we work, and that is to be able to provide for the needs of our loved ones. So the time came for a doctor's appointment, and way before that day came, we planned ahead. My brother, niece, and I went with them. So there's someone to run the errands like push the wheelchair and make sure that my parents have face masks and face shield. We brought alcohol, water, wipes, adult diapers, extra clothes, food, and all the necessities. I realized it was just like bringing my baby to a pediatrician. I made sure to protect them by a constant reminder of not holding on to anything and giving them alcohol rub often. Thankfully, the people we encountered were just as concerned for us. When my mother was requested to have her MRI, the protocol was to have COVID-19 swab testing first before entering the hospital. I was so concerned of my mother falling in line for swab testing in the hospital that the medical technologist decided to leave her post and get the test with my mother staying in the vehicle. These are simple considerations that was necessary for her safety. In this picture is the appointment slip emailed to us by the hospital where my mother will have her brain center consult. We can we can only have one companion, and my name is listed here with the date, time, and room of the consult. In this case, we're only allowed to enter the hospital premises 15 minutes before our appointment. The nurse calls us by phone when we can come up to the doctor's offices, and this is to ensure minimal contact with people in and around the hospital. I will always be thankful for technology in healthcare. I wish my parents were not as reluctant to the use of technology, and that more of our senior citizens have access to technology for healthcare use. There is actually a study which says that older adults who undergo a computer literacy program results in a favorable attitude towards computer and the internet. This study highlights the importance of a telehealth literacy program in ensuring compliance and engagement among older adults. But what is telehealth? Telehealth is the delivery and facilitation of health and health related services, including medical care, provider, and patient education. The University of the Philippines has the National Telehealth Center. It was listed as a research institute in Manila when you search for it in the web. It actually has the goal of making health services accessible for every Filipino. But since I have limited knowledge of it, I will be talking about my experiences in the private sector. In the private sector, there are also other options when a senior citizen seeks consultation and treatment, one of which is the use of mobile health, such as devices that collect data and share this information to physicians and their patients, like the ones that we use as previously described. As an alternative to consulting, a patient can also use telemedicine or the use of technology to remotely deliver health care. Through this, physicians can treat patients whenever needed and wherever the patient is. By using a computer or smartphone, that is what we use for my parents. So here we had also Zoom meetings with my mother's neurologist, and we really find several benefits from doing it. Primarily, it is convenient as we do not need to wait and fall in line outside the physician's office or clinic. It's also considered to be safe as the consultation can be done in the comforts of home. Thus, both patients and physicians are not exposed to infections in hospitals or clinics. I've realized that it's also cost less since we were charged a discounted rate because there are no clinic or personnel costs with the consult. The physicians also allot an hour consultation time per patient, thus more interaction time is given to the patient and her significant others. The physician also allot an hour. There, when the doctor also wants to do an assessment, we simply zoom in the body parts that he wants to see and follow his instructions. All my family members can join in the meeting and ask questions regarding the patient's case. As seen in this email, the consultation fee is also paid by cashless transactions like GCash or bank transfer. My father's diabetologist used a MedCheck link, which is a secure private account set up by their clinic. It has the requirements of only at least 2.5 Mbps internet. Initially, before the consult, we were asked to consent to the use of an EMR or an electronic medical record wherein all files of my father is placed in soft copy. Their payment option is also through bank transfer, GCash, or PayMaya. Their security measures include emailing medication prescription and laboratory requests only after payment has been made or transferred. A proof of payment is sent through Viber or an FB Messenger. My father's physician also created the group Viber, a Viber chat group with her as diabetologist, me as significant other, and a dietitian to handle his nutritional needs. In the Viber group, we update them of my father's blood sugar level and his needs. We can also ask questions at any time in the Viber group. It's also a good tool to set up our appointments for regular consultations with the dietitian, a physical therapist, and our diabetologist. I have compiled a list of my learnings on on what to do with the six senior homebound. First is they need to have technology, of course, like a smartphone or a tablet, a laptop, and of course, internet access at home. You see, in case of emergency, they can easily ask help through this, and it's also a faster way to maintain communication with family members who are far away, like us. This can also be a means to deliver services like food or medicines at home. In the long run, as my niece is also working, we needed to hire a caregiver who looks into the welfare of my patients. The caregiver monitors them and does medication management. She gives them a variety of activities like assist with walking, exercises, and reads with my mother to prevent cognitive decline. But most importantly, even with a caregiver, nothing can replace the love and affection given by family members. It's a powerful force that makes the senior citizen want to get better and maintain good health. As carer for my parents, I try to keep calm every day and carry on with the challenges and trials brought about by the pandemic. This reminder is shown in the matching shirts of my mom and I. On the next picture, my younger niece made the signage and placed it in my parents' house to remind them to relax and not stress themselves because there are people who love them. And of course, this too shall pass. Thank you for listening.
Thank you, Dr. Cuevas. And yes, I'd like to also highlight what Dr. Cuevas said. This too shall pass. Ang ganda ng presentation ni Dr. Cuevas. I really did feel the tug at the heartstrings because I also care for my own two parents, senior citizens. My mom also has dementia. We actually have the same doctor. But having said that, thanks for that. And for more information on, so Dr. Cuevas already started touching on the healthcare pathways. We have 500 participants in the Zoom room. There are 274 in YouTube, so it's around 700 to 800 people watching us right now. And before we go to the question and answer, which I encourage everyone to please use the Q&A button so that you can type in your questions. You will notice I intentionally disabled the chat room on Zoom so that please use the Q&A. You can type in your questions there so that we can record them properly, so we can ask them later when the time comes. Now, before that Q&A, let's hear from our third, definitely not the last because he's the last speaker, but just so happens that in order, the last but not the least, Mr. Tom Hayet to discuss with us more on this healthcare pathways for seniors in the time of COVID. Over to you, Tom.
Salamat talaga, Albert. Thank you very much at magandang umaga sa ating lahat. So I'll be presenting a bit on COVID-19 patient pathway, and then we can have, of course, some Q&A din. So this presentation na to is for, of course, yung elderly, for lolo and lola. Pero gayon din, it's also for those living with the elderly, their children, apo, pamangkin din, who might be living with them. So hopefully this is applicable din sa inyo. So i-cover natin ito sa patient pathway na to, how to know you are sick, what to do if you are sick, what to do if you need to seek care, what will happen at the health facility, what to do after recovery, what to do if you are in contact with someone with COVID-19, and what to do if someone else is sick, what to expect from care providers, and what to prepare. So una, start tayo sa how to know you are sick. So binanggit kanina ni Doc Sibel, yung mga symptoms ng COVID-19, fever or chills, cough, shortness of breath or difficulty breathing, fatigue, baka muscle or body aches, headache, a new loss of taste or smell, or sore throat, and congestion or runny nose, nausea or vomiting or diarrhea. So baka mapansin ninyo that these symptoms, yung mga ibang illnesses din, same naman yung symptoms nila. So hindi natin ma-diagnose ang COVID-19 from symptoms alone. But this is what to look out for. So what to do if you are sick? So what to do if you are sick? Una, stay home and seek medical advice through telemedicine, gaya ni binanggit ni Doc Cuevas sa last presentation. You need to rest and hydrate. Keep your mental health in check by avoiding scary media. Sabi din ni Doc Cuevas to remain calm. And stay connected. Yan din ang sabi niya, very important. You can treat your cough with warm lemon honey water, pwede din yun. Treat lagnat with paracetamol, and then your body does the rest. So sa ngayon, wala tayong treatment for COVID-19. Walang medicine that's proven effective, pero meron in trials. Pero sa ngayon, this is the best we can do to parang ilakas natin ang katawan to maglaban sa COVID-19. Pero kung meron kayong symptoms na ganito, binanggit din ni Doc Sibel kanina, difficulty breathing, shortness of breath, persistent pain or pressure in the chest, mental confusion or changes in alertness, drowsiness or difficulty waking up, pale bluish face and lips, yung mga symptoms na to are very emergency symptoms. Ibig sabihin, mababa yung oxygen natin. And very important. Binanggit din ni Doc Sibel, this oximeter, na kung meron kayo nito, pwede din gamitin ito. You just clip nyo lang sa daliri, and then makikita nyo kung mababa yung oxygen saturation sa blood. So kung mababa siya ng 90% or even 94%, ibig sabihin low oxygen, and that's an emergency situation. So, kung may sakit kayo, meron kayong kasama sa bahay, ito din sa kanila ang importante. Kailangan mag-cover cough sila and maghugas ng kamay, maghugas ng surfaces. And yung pinaka-importante is magkahiwalay. So, kung mayroon kayong kwarto na pwede kayo manatili, and then yung iba sa labas. Pero kung wala, kaya na binanggit ni Doc Sibel, pwede din maglagay ng barrier, wooden barrier or kumot, nakabit, kahit ganyan, para may separate space naman. And then, wag mag-share ng items sa may sakit, and kailangan magsuot ng medical mask kung magkalapit sila sa may sakit. Sa inyo, kailangan mag-mask din kayo and mag-face shield din para yung virus na nasa inyo, hindi siya lalabas, hindi siya pupunta ng malayo, pero manatili lang siya sa mask. Para sa mga tao na meron elderly in your lives, tayong lahat, either nakatira kayo sa kanila or pumupunta kayo sa bahay nila, importante na you're a hero for staying home. So una, avoid the places where COVID spreads. So kung bata lang kayo, pero gusto nyo magbarkada or wherever, kahit saan sa loob na nagtatransmit yung COVID, iwasan natin yun. Because kung mababa yung risk sa inyo, mas mataas yung risk sa lolo at lola nyo. Gaya na sinabi ni Dr. Sibel. And then kung may sakit kayo, stay home. Huwag pumunta sa bahay ni lolo and lola and keep them safe. So that makes you the real hero. What to do if we need to seek care? So if you need to seek care, ibig sabihin you have some symptoms na sinabi ko kanina, emergency warning symptoms na kailangan yung i-asikasuhin. You can use the Pure Force Citizens app. So kung meron kayong nakita ito, maganda naman, libre din. This is developed by DILG, the Pure Force Citizen app, na pwede na niyong gamitin for emergencies. So kung pindutin nyo sa Pure Force, diretso sila mag-respond or tatawag din sila sa inyo kung maglagay kayo lang ng message. So that's a very good one for emergencies. Pwede din gamitin yung hotlines ng DOH, One Hospital Command Center, or DOH Telemedicine, or meron din mental health crisis hotline, pwede din yung gamitin. Pero these emergencies need to be taken care of immediately. What will happen at the health facility? So sa health facility naman, if you have emergency warning symptoms and signs, what they will do is yung first is high flow nasal cannula, which is oxygen therapy. Na binanggit ko kanina, kung mababa yung oxygen, kailangan magdagdag ng oxygen para makatulong sila. Sa ngayon, your body does the rest. So wala tayong ibang treatment for COVID, pero malakas din ang katawan natin kung we care for it din and meron siyang supplies na kailangan niya. Pero it's not enough kung meron kang underlying conditions na binanggit kanina din. High blood pressure, diabetes, heart disease, heart attack or stroke, chronic respiratory disease or cancer. Underlying conditions make it very difficult para maglaban yung katawan natin. So kung meron tayong nito, we need to manage these as well as we can para mas malakas ang katawan. So what to do after recovery? So pagtapos na ang sakit nyo, baka maramdaman yung breathlessness or mawala yung boses or nahirapan tayo sa swallowing or eating or drinking. Kung ganyan, kailangan i-manage natin yan at tulungan na babalik yan onti-onti. So be patient with yourself din. Importante din ang exercise. Body exercise and mind exercise din. So yung mind exercise, we have puzzles or Sudoku or chess, mga ganyan that works the mind, that keeps it sharp. We need to manage attention, memory, and thinking clearly. Importante naman yun. So if after any illness, mababa yun, ma-apekto yung attention, memory, and our thinking natin. So i-adjust natin yung expectation and para mababalik yun. And then we need to manage daily tasks natin. When we come back, makabalik tayo sa hospital, we need to get back to daily routine. And then stress and mood, importante naman yun sa mental health natin. And then this will be covered, I think, sa presentation bukas sa mental health. So yan after recovery. Pero what to do if you are in contact with somebody who is a COVID-19 case, but you are not sick? So ganito, if you are within 1 meter of a person with COVID-19 for at least 15 minutes in the past 14 days, ang tawag natin dyan is close contact. So kung ganyan, anong kailangan niyong gawin? Quarantine for 14 days. Na binanggit ni Doc Sibel kanina, including being separate from family members para hindi mahawaan sila. Kung ganyan, yung quarantine natin, if halimbawa yung last contact natin with COVID-19 was on the 1st, quarantine natin for 14 days hanggang 15. So kung halimbawa mag-start siya sa tanghali ng 1, mag-stop siya sa tanghali ng 15 para kompleto ng 14 days. What to do if someone else is sick? So kung ibang may sakit, kung kay matatanda or bata pa rin, we need to support them to stay home for 14 days para hindi mahawaan ng iba. We need to advise them to seek emergency medical attention kung meron silang emergency warning symptoms and signs. Give them moral support. Of course, this is quite a challenge, so support natin sila. And we need to protect ourselves. Protect yourself. Limit contact. Use a mask. Clean hands and surfaces. Importante din yun. If you share a space with this person na may sakit, buksan ang bintana and magpalayo. So, hindi kayo masyadong malapit. What can we expect from care providers? So, sa care providers natin, you might know that frontliners may visit you for contact tracing and testing. They may also request you to quarantine or isolate. So quarantine, isolate, actually same naman yun, mahiwalay tayo. Pero quarantine is for contacts na wala pang symptoms. Isolate is for cases na may symptoms. So isolation may be improved in approved homes, hospitals, or TTMF. TTMF is Temporary Treatment and Monitoring Facilities na ginawa ng government. Medyo depende ito sa LGU. So karamihan, sabi nila kailangan yung elderly sa hospitals lang. Pero yung mga ibang LGU, ibang practice nila. So depende kung saan kayo, pero yan ang nangyayari. Meron din Oplan Kalinga, which has preemptive isolation as waiting for testing. And pwede rin gamitin natin yun in isolation centers, which are air-conditioned with food and Wi-Fi free, which is quite good. And baka meron din granular lockdown of specific containment zones na sa neighborhood ninyo, sa barangay or street ninyo. So last now, what to prepare? So while we're waiting, hindi tayo sakit. So una, tignan nyo yung special measures na meron kayo for food and health services. So anong pwede sa food delivery or ibang ways niyon? And gaya na binanggit ni Doc Cuevas kanina, anong health services na telemedicine na pwede gamitin nyo? Tanungan nyo sa doctor ninyo, pwede ba mag-Zoom? Pwede ba mag-group chat gaya ng sinabi kanina? So anong pwede sa health services para alam nyo ang options ninyo? Tapos kailangan iisip nyo ang backup kung meron kang caregiver at naging contact siya, hindi pwede siya pumunta sa inyo. So sino ang pwedeng backup na tumulong sa inyo kung baka sakali yung primary caregiver nyo ay hindi pwede. Ngayon din, baka may ibang location na pwede kayo pumunta kung kailangan. So, ngayon din, living arrangements in case quarantine is required. Kaya sabi kanina, kung may separate kwarto para pwede mag-isolate or divider, anong dapat gawin yon? So, isipin natin yon ngayon para mas prepared tayo. And then, reduce natin the risk. So, pwede natin gawin touchless greeting. So, huwag magyakap or magmano. But we can do touchless greeting and even better, connecting through technology para no visitor policy, kaya nang sinabi kanina. Manage the airflow sa bahay and gamitin natin yung mask din. And kung kailangan, we can use the outdoors more para mas airflow is mas maganda sa labas, siyempre. And then lastly, pwede natin isipin yung increase of stock of food and medicine na sa bahay para kung kailangan manatili tayo sa bahay ng 14 days, hindi tayo mahirapan dyan. So mas prepared tayo dyan. So kung prepared tayo, then we have this complete patient pathways maisip natin. Sana makatulong ito sa mga tanong ninyo. Kung meron pa, pakitanong sa Q&A session. And then makikita natin yung magandang horizon. So last na yun, we love our elders. Let's keep them safe. So maraming salamat po sa inyo.
Maraming salamat, Tom. At mukhang marami ring natutuwa na nagtatagalog ka pala. Hindi po siya nagpapanggap. Tom can really speak in Filipino. He's been here in the country for quite some time. So don't be surprised. But having said that, thank you so much, Tom, for that presentation on healthcare pathways. I am sure a lot of people have been recording what you were discussing because it just summarizes the movement of the patient throughout the health system, so to speak, with emphasis on our senior patients. So now we are at 11:49 in the morning, but don't worry, there's a lot of time to accommodate questions. I already have quite a few questions in the Q&A box. For those of us who are in the Zoom room, please use the Q&A button in your app. You can type your questions into the Q&A interface and we will see it here. And for those of you on YouTube, you can also type your questions into the chat box, the live chat box. All right. So before going to the questions, I'd like to read first so that the panelists are also aware. There's a lot of thanks. There's an anonymous user who says that as a student, this is very informative, especially because we care for our older adults. And it's part of our class this semester on the care for older adults. Thank you very much. All right. And we have a message from Dr. Margie Holmes. Thank you so much for all three presentations. I will be unable to attend tomorrow's lecture. So everyone who is not able to attend, don't worry. There will be recordings. We will be sending out the links to these recordings and also the links to the presentations. Let's go to the questions now. I think the first question is for Dr. Sibel Abad. This is a common question among all patients, senior patients, asked of all doctors, including us general practitioners. Will flu and pneumonia vaccines prevent the complications of COVID-19 for the elderly? Or maybe I'll make it a bit more generic, Dr. Sibel. Is there value? Mahalaga ba na dapat ko magpabakuna for flu and pneumonia as far as our seniors are concerned? Dr. Sibel.
So thank you, Dr. Albert. And yes, there is still a value to getting a flu shot and pneumonia vaccines for the elderly. They will protect you against flu and pneumonia. Unfortunately, they will not protect you against COVID-19. So magkahiwala yon. Those are two separate issues. No, if you get a pneumonia from COVID-19, that's COVID-19 related pneumonia. It's a different kind of pneumonia from the pneumonia shot, which contains a bacteria. So it protects you from bacterial pneumonia. But nevertheless, even though they're separate, you should still get your flu shot and your pneumonia shot because you can still get a bacterial pneumonia on top of the COVID-19 or a flu on top of the COVID-19. So it pays to have protection against both, no, if you can. So please don't delay getting those vaccines.
Thank you, Dr. Sibel. So don't delay getting those. Malinaw po yan, no? It does not protect against COVID-19 itself, pero nakakatulong po siya sa ibang aspects which can still somewhat prevent complications pag nagsabay-sabay kasi dun sa sakit. So don't delay getting those vaccines. Just know what it is for and what it is not for. The next question is for Dr. Pearl. Ayan. Dr. Pearl, what are your tips on teaching the elderly in using technology? Makikinig rin po ako dito. How can you encourage the elderly, our seniors, to use technology? Dr. Pearl.
Okay. Actually, your technology is very much a part of our lives now, and we want to encourage our senior citizens to also take part, no, in this technological revolution. In fact, no, there is one advertisement, I think, that says merong lola techie, no. So to encourage them, first of all, we have to find what is interesting to them, no. We want to, like, for my mom, she likes playing games, and it will help in her cognitive decline. So as to allay this problem, no, she plays games from the simplest and then moderate and then to a more difficult one. So that's she has to get to feel that she likes it first, and then she gets into it, and then she later on gets to the habit of it. So I think if we want them to embrace also the use of technology, we have to find their interest first. What would interest them? Is it social media? Is it gaming? Is it emailing? Or like, or is it reading books? Like for my father, I mean, he would probably like YouTube more because he's interested in knowledge. So let's look at their interest, and then from that interest, we build on something until it progresses that they really learn to like the use of technology.
Thank you, Dr. Pearl. Talagang it's like caring for kids. I don't have kids of my own, rather, but I understand, no, kasi you have to get them interested.
Yes.
So this next question naman is for Dr. Hiro, our panelist coming from the WHO Regional Office for the Western Pacific. Dr. Hiro's area of work is on healthy aging. And now that it's COVID-19, of course, all of us are dealing with COVID-19. So one of our participants asked this: is wearing a mask at home mandatory for all family members, especially those who have seniors at home, while bonding or maintaining physical distance while dining or watching movies. Essentially, what could be a good way for us to prevent the transmission of infection to our vulnerable seniors when at home? Dr. Hiro.
Yes, thank you very much, Albert. So to this question, we are recommending to take a best possible precaution. So including the wearing mask if possible, and then social distancing, lots of good ventilation, and then secure the space for older people if necessary. And particularly when the sort of older people or some family member develop certain symptoms, it is very important that person has a good isolation and others have a very good precaution of personal hygienes. So it is recommended. But at the same time, I understand that wearing a mask always at home may be difficult and that can sort of decrease the bond. So if you have a good sort of a social distancing and the ventilation and or maybe like a talking outside, then we may not need to wear the mask necessarily, given that other things are in place. But in a closed place and then the ventilation is not very good, I think it's highly recommended, particularly to when to interact with the older people wearing the mask. And then that is considered at least to prevent the infection from you. And then younger people, it is possible that they are carrying the virus without knowing it. So this precaution is quite important.
Thank you, Dr. Hiro. So Dr. Hiro already indirectly answered the question from Hillchrist Gilera because Hillchrist was asking, are asymptomatic patients less contagious? Are pre-symptomatic people less contagious? In summary, well, there are differences between asymptomatic and pre-symptomatic, dear viewers. But as far as we are concerned in public health and also in the clinics, it's all about protecting you from any risk that you are exposed to. So no need to split hairs between the pre-symptomatic, asymptomatic. Please consider everyone a possible transmitter and do your best so that your lolo and lola will not get the virus. Now, having said that, this next question, Dr. Pearl, I think there's a lot of practical questions and I'll be directing them to you because I'm sure you have a lot of experience. So this one coming from an anonymous attendee goes like this. Our caregiver for my elder mother is live out, stay out, but renders duty 1 week at a time. Then a second caregiver relieves her for the same duration. Basically, they alternate weekly. Do you have any advice to ensure that the risk for my mother is reduced because they could not find a live-in or a stay-in caregiver? Very practical. Dr. Pearl.
Okay. Actually, there are research which says that it is our caregivers or our stay out maids that bring in the virus, no, inside the house. No, so because we don't want that, the very basic answer is really to educate them. Education is empowerment. No, we have to teach them how to care for themselves to maintain their health, and then when they enter the house, make sure that they're clean. You don't let them enter the house without, like for me, my father-in-law lives with me, so whenever my stay out helper comes in, she comes at the back. I make sure that she's clean. We inspect her, and so when she enters, she is aware of the precautions that she needed to take. No, she does not need to wear mask inside the house, but we make sure that she's clean. She prepares her food well, no, and all the necessary precautions that was mentioned. She is well educated on that. So again, education is empowerment, and we should also empower our caregivers, no, so that it does not just help your family, but it also helps her family as well.
Thank you, Dr. Pearl. I'm not supposed to give inputs because I'm a moderator, but since I have experience also in our own household, our kasambahay or our maids, we still give them days off. But I discussed with them so that instead of having 2 days off in a month and 2 times, we just compressed it into once a month, but 2 days at a time. And like what Dr. Pearl said, a lot of education to the point that I provide them hand sanitizer, I provide them face masks so that their own house is also protected because their behaviors are also going to impact on our own household. Now, this next question is for for Tom. Yan, may tanong na sila, Tom. Pero English yung tanong, pero pwede mong sagutin however way you want to answer it. So, Sir Tom, how can we encourage our abuelas and abuelos? Now we're speaking in Spanish. Abuelas and abuelos, our lolos and lolas, to go to the hospital nowadays. So we heard from Dr. Sibel that we want our seniors to stay at home as much as possible if it is not a critical, a presentation. But sometimes we really need to bring them to the hospital. And our participant is asking, how do you encourage our lolos and lolas to go to the hospital when needed because they're all afraid and they will opt to suffer at home? Tom.
Very good question. Salamat din dyan sa Tagalog and Spanish. Halo-halo dyan. Very good. So una, I think we need to acknowledge the wisdom of our elders din. Na actually tama naman yun, we should not go to the hospital unless we need to go to the hospital, for sure. Yan ang sabi ni Doc Sibel kanina. We know that there's an increased risk there. So una yon, we need to acknowledge na tama naman, and some of that fear is well-founded. Pero pag kailangan, I think we can reduce some of the fears para i-explain natin what we're doing to ibaba yung risk. So number one, Cuevas kanina, we can schedule an appointment para hindi tayo isang oras sa waiting room kay sino man nandyan. Right? That's one thing, right? And then pwede tayo maghintay sa labas until tamang yung appointment natin, pasok naman tayo. So number one. Number two, I think maganda din ang example ni Doc Cuevas is bringing hand sanitizer, mask, yung mga preparations they're done. So we know that hindi kaya natin ibaba yung risk to zero. It will never be zero. Pero pwede din ibaba natin, and we can have concrete examples na pwede ipaliwanag sa kanila. Okay, this is the risk, pero ibaba natin yung risk for these reasons. And then para mas ma-convince sila na pumunta sa hospital. Pero, and then in contrast, na binanggit nyo, suffering at home is very risky as well, right? So kung maisip natin may risk pupunta sa hospital, kung emergency is a bigger risk, manatili sa bahay. So we need to do a risk management and take the path of least risk.
Thank you, Tom. So, aatras tayo. We will step back a bit because Tom already explained how to convince our seniors who need to go to the hospital to go to the hospital. But the question remains, and this is a very good question from Maria Teresa Orejudos. So, Maria Teresa is asking, and I'm directing the question to Dr. Sibel Abad, our infectious disease specialist. How can we determine if the case of the senior patient can only be checked through teleconsultation versus the need to have a physical checkup? So how do we imagine, ma'am, that I am not a medical doctor, as most of our participants are, and then how can they decide or help decide if the senior needs a physical checkup or a telemedicine checkup is okay? Dr. Sibel.
Yeah, so that's a very difficult question and a very important question. No? Pero may mga certain signs and symptoms that you look for na nabanggit ni Sir Tom kanina, and nabanggit ko din that there are certain alarm symptoms that you look for, which may mean that you have to bring your lolo and lola and your mom and dad to the hospital. No? So yung mga symptoms na yun include chest pain, for example, na hindi nawawala, or shortness of breath, or so hingal, no? Nahihirapan huminga, or they're turning blue in front of you, so parang nangangasul yung kulay nila. So those are all alarm symptoms that I think you don't need to wait. You can just bring them to the hospital, probably the ER right away. No? Now, if they seem to be okay, they're speaking to you in sentences, they can still hold a conversation, kaya pa nila makipagchikahan with you. Then if they have minor concerns, like maybe a headache or maybe just a fever, then perhaps you can go through with your teleconsult. The good thing about the teleconsult or virtual consultation is the doctor can also help you triage. No? Pag nakita ng doktor, it looks like lola and lola are breathing heavily, for example, or talking, having difficulty talking, sasabihin na nila sa inyo, I think you need to go to the hospital. No? So the teleconsult also serves as a triage to try and help you decide whether or not you can stay at home or whether you need to go to the hospital.
Thank you, Dr. Isabel. That's well received. And interestingly, even if you have a doctor in the house, it's actually harder. So as a GP, I mean, because we are all aware of the alarm signs, konting ubo lang, kinakabahan po ako. So we share your anxiety, but we're all in this together. That's why we're having this discussion. And related to that, this next question is for Tom. What about the elderly who have other illnesses who need to go to the hospital, but it's not COVID-19? So Tom, will the elderly having a different illness still be admitted in hospitals for medical checkup if needed? Tom.
Thank you. Good question. So sa alam ko, it's almost all hospitals, yes. Depende din sa hospital. So tawagan nyo sila muna. And they might have some provision. Baka meron silang pinto pang respiratory symptoms na ginagamit nila, and then may ibang pinto for other regular checkups. So para hindi maghalo yung dalawang population na yun. So tawagan nyo sila, what is the proper presentation. And siyempre, kung kaya pa rin sa telemedicine, mas maganda dyan. Pero alam natin, telemedicine can't do everything. So kung kailangan talagang pumunta, tawagan nyo sila and tignan yung protocol ng hospital.
Thank you, Tom. All right, so we've been discussing a lot about the hospitals. The time is 12:05. A few more questions are most welcome. This next one, I'm going to ask from Dr. Hiro. So we've all been advising our elderly, our even the family to practice, hand sanitizers, use hand sanitizers, wash your hands. So the question goes, are there potential toxicity risks at home from the use of too much bleach, alcohol, sanitizers, and other disinfectants? How do we manage or lower these risks? Dr. Hiro.
Thank you very much. So as far as our guidance is concerned, that those sort of alcohol or disinfectant like sold at the pharmacy, not about sort of industry sort of a type of concentration. At the things that are sold at the pharmacy, I think that the safety is well established. Unless like you are exposed like a 24/7 for next 3 months, then I think there might be some toxicity. But otherwise, I think it's just a sort of regular cleaning and then wiping, and then hand sort of a cleaning of those things, I think is quite safe.
Thank you, Dr. Hiro. So remember what Dr. Hiro said, whenever the DOH and WHO gives advice, the assumption is, and it's always written down here in the advice, that those products are the ones sold to to retail users. Meaning, yun pong mga bumibili sa mga suking tindahan. Huwag po kayong pupunta sa mga factory. Don't go to factories. Don't go to the industrial strength. No, that's not for us. You go to your grocery, your local drugstore, and those are the safe ones to use. And follow the directions on the package, or also the advice given by DOH, WHO, or your doctor. So I'm seeing a lot of questions asking for copies of the presentations, which is a good sign because they really want to digest this. And there are also a few who have been messaging saying, I can't make it, not to worry. All presentations and all the links to the videos will be made available online even after this particular webinar is over. I see also a few questions here asking, already touching about dementia. I think the story of Dr. Pearl on caring for dementia already opened the questions, but don't worry, tomorrow is the more detailed webinar session on mental health concerns. We will really ask these questions and discuss this with another set of panelists who are going to be, I think we will include the neurologist and also others in that particular line of work and line of practice. Okay, here we go. Oh, this one, maybe I'll ask from Tom. Second to the last question. Tom, how effective is contact tracing? Nabanggit mo kasi kanina na someone might call them for contact tracing. So the question now is, how effective is contact tracing? Are we doing it enough? Is it safe to travel at all right now? And yun pala, the next question is already a different question. Is it safe to travel and go to the hospital? Already answered. Let's go back. How effective is contact tracing? Tom.
Very good question. Very, very good question. So to answer in short, it's very effective when it's done right. And yung second question, are we doing enough? No, we are not doing enough. So right now, we have pharmaceutical interventions and non-pharmaceutical, which is medyo mahabang word, pero pharmaceutical is vaccine and drugs. Wala pa tayong ganyan. So we only have non-pharmaceutical interventions. Contact tracing is one of the very best. So kung perfect yung contact tracing, we would not have COVID for sure. Pero it's hard to do perfect contact tracing because we don't know for sure that exactly who has the virus, yung testing in this. But yung contact tracing is very effective. So when we see in yung ibang bansa din, where contact tracing is done very stricto talaga, it's very effective, right? It very much limits this spread. So please, when government workers are coming, please be cooperative. Please provide yung information of contacts. When they ask you to quarantine, please quarantine and stay at home. It's for the benefit of all of us. Parang bayanihan yun sa atin. Thank you.
All right, and this last question, it is more on health promotion of seniors, but I wanted to ask it to end the session on a light note, and I'd also want to ask it from Dr. Sibel Abad. I know Dr. Sibel is a clinician, but I'm sure this is also one of her kumbaga, she can answer this as part of preventive medicine. And the question goes, from Krishnan Paras, my parents prefer walking around the village as a form of exercise. Is it okay? And also, is it okay to do brisk walking while wearing a mask? Favorite question. Is it okay to wear a mask while exercising? Now, for seniors, Dr. Sibel.
So depends on the village, I guess. If your village is, I'm assuming it's well spaced, no, because it's a village, no, and usually outdoors is a better area actually to walk around. Kasi as Tom mentioned earlier, it's well ventilated outdoors. No, so actually that's probably the best way to go exercising. No? Just don't go exercising in a group. If it's just your mom and dad and they're together all the time, then go ahead and exercise. No, that's a great way to be outdoors, enjoy the sun a little bit. Now, in terms of wearing the mask, I guess it depends on how healthy your mom and dad are. If they have underlying diseases, no, kunyari merong underlying chronic obstructive pulmonary disease, kung smoker si daddy or si mommy, no, tas medyo hingal, no, baka pwedeng walang mask when they're walking outdoors, no. Pero kung wala naman, then I would still advocate the use of masks. Because it still is a second layer of protection while outdoors. No? But I'm assuming you're walking out in the village, hindi kayo sabay-sabay with the other people in the village. No? You're kind of on your own. And that's enough. That's okay. So I think that's a very good way to exercise actually during these times of pandemic.
Thank you, Dr. Sibel. Naalala ko lang, I have a friend na her senior mom started calling her amigas for Zumba sessions. So I had to caution her that no, don't exercise all together. If you want, do it Zumba via Zoom. All right, Zumba via Zoom. All right. So thank you so much, everyone. The time is 12:12, and before we end the session, I just wanted to share these QR codes, which I think a lot of us would find to be most useful. Of course, the favorite question is where can we get the slides? That's coming up in a bit. But before we show that link, we ask everyone who is participating to please let us know your feedback for day 2. Okay, there is a URL there, pero para sa ating mga seniors, I'm sure marami na rin mga techie na seniors. You can point your phone camera to the QR code which you're seeing on the screen right now, and your phone should show the URL or the internet address that will allow you to give us your feedback for day 2. Okay, so please let us know your feedback for day 2. And then the next slide I'm about to show is the link to the folder. When we say folder, all of the presentations are going to be there in PDF format, and we'll also put the file with the links to the YouTube recordings. Yes, these recordings stay on the WHO Philippines channel so that you can watch them, you can share them. As they say, the DOH says, di ba, meron silang bida solusyon. Letter A, alamin ang tamang impormasyon, know the correct information. If alam ko po to marami po tayong mga seniors na naka-Viber, naka-WhatsApp, naka-Telegram, pero mostly on Viber. If you get a message and it is not from the WHO or the DOH or a doctor whom you personally know, please do not forward it anymore because it's probably fake news. It's probably going to cause stress and anxiety. Instead, forward the webinar series of WHO and DOH, and this information will help a lot to give the correct advice for seniors. All right. Having said that, thank you so much to all of our participants, and I'd just like to call Dr. Hiro for the final words before we disconnect. Any final remarks or words of advice, Dr. Hiro?
No, thank you very much, Albert. So I don't have many because yesterday we talked about the importance of prevention primarily, and then today we talked about the importance of management. So this is quite important. And then I wanted to emphasize for tomorrow that this is particularly important when you have older people at home or neighborhood with the dementia, because that has a lot of implication for the care of older people and then care for caregivers as well. So hopefully that we will address more with our colleagues tomorrow. And the other thing I wanted to point out is Dr. Chavez Sivas, mentioned quite important things, which is like a use of internet and then IT technology, because it's increasingly obvious that the internet technology is playing a very important role for one's health. And then our health workers, health sector people, go talk to the people and go talk to the doctors and talking about importance of health promotion, nutrition, and then exercise, and then infection prevention. But we rarely talk about, oh, please make sure to use the internet, or let's sort of talk about use of a more information technology. But information technology is very important, not only to provide a healthcare, but also to give access to the information and then access to education, access to food nowadays too. So I think it's good that all of us, like people in the health sector at the different levels, advocate for the use of internet. So we can sort of teach our parents and neighbors how to sort of use internet. That's one thing. And then also, like if you are in charge of a health promotion in different municipalities, you may want to invite someone from the IT sector to, when we talk about the nutrition and exercise, maybe we can talk about the use of internet, bringing someone so that older people and then their caregivers are aware that this is a very important part of the health promotion now. Okay, that's it. And then thank you very much, Albert, and then other panelists.
Thank you so much, Dr. Hiro. Maraming salamat to all of our panelists also and our participants. Still 431 in the Zoom room and in the YouTube channel, 283. So still roughly close to 700 even at 12:16. We wish everyone a good day and a happy lunch for those of us in the GMT 8 time zone. We do have watchers from all around the world, so stay safe wherever you are. And good morning, good afternoon, or good evening, wherever you are. Thank you so much.